Even more important, perhaps, than me feeling comfortable with it is the comfort that it gives my patients. What I can tell you is when I talk to patients about, hey, I have a couple options for you, a CAT scan, a PET scan, a biopsy, or I could do this blood test. They just perk up and they're like, blood test? I can do a blood test. I don't have to do a procedure. I don't have to wait 3 months and go to bed every night thinking that I have cancer. Let's do the blood test. My big concern with this, personally, as a physician, was, are my patients going to get a bill for this, and is this covered? Because if they're getting bills and this isn't covered and it costs them thousands of dollars, I'm not going to do it. What I can tell you unequivocally is, having done over 150 of these, I haven't gotten a single phone call from a patient. I haven't gotten a single bill. And I told them specifically, if you get a bill for this that's not covered, call me. And over 150 patients of varying insurances, I've never gotten one. And that's reassuring to me. I've always had that confidence with Biodesix using Genestrat and Veristrat, that if there was a coverage issue, that it was always taken care of on the back end by Biodesix. So that's something that's reassuring to me when I think about using this in a clinical setting for my patients, is making sure that I'm not doing something that's going to financially harm them.
But anytime we have a new test, it's very important that you are keenly aware of what the cost to the patient would be. So looking at the XL2 test, it is covered by Medicare, so there's 0% out-of-pocket cost. If the patient is uninsured, again, Robbie, you can probably speak to some of this, but we have financial assistance available for them where they disclose the indication. I have to disclose that I'm using it in the appropriate patient population. They then disclose their financials. The goal is to make sure that the out-of-pocket cost to each of our patients who use this is minimal.